Make Brijesh co-host.
आपका वो चालू है सर. Who's taking the questions today?
हिसाब से भर्ती के हिसाब से तुम्हारा ऑपरेशन होगा. परसों भी रखा था बट परसों 2 मरीज का ऑपरेशन लंबा खिंच गया. जैसे आज तुम्हारे सामने वाले एक और इधर जाओ, 2 मरीज का कैंसिल हो गया. दयाल था एक और था.
Sachin and Jamie.
Who is answering today? Sachin and
Jamie.
Jaimin. And Paras will be a special invitee. Unmute Paras also. Huh?
Okay.
Sachin, is your name displaying as Vivo? Okay, just change it. I think you're muted also, Sachin. We can't hear you. Jaimin and Sachin are presenting.
Yes, sir.
Yes, sir. Yes, sir. Good evening, sir.
Good evening.
Good evening, sir.
Good evening. I think Pankaj sir, Gaurang Shah, Gite sir, everybody has joined. Brijesh?
Yes, sir.
Okay, just ask sir and then we can start.
Okay.
Sachin has joined.
Yes, sir.
Okay. Shall we start then?
Yes, sir.
Yes, sir.
See,
We can start, sir.
the thing is that I don't think we will be able to finish in, you know, I don't think that we will be able to finish in, like, you know,
सर यूर सर आपका आवाज ब्रेक हो रहा है सर.
I think
go very system. We can finish today lower track. If anything is okay, can you hear me now?
yes,
Yes.
sir.
Yes,
Your
sir.
voice had gone, sir, in the middle.
So what I was saying, we may not be able to finish in one class. No problem. We'll continue the next class, but let us go very systematically. So now
Okay,
we
sir.
will start with the lower track. If we cannot finish lower track this time, including everything, whatever questions are asked, then next time also we can continue.
Yes, sir.
Yeah. Okay. Gite sir, Maheshwari, even Hudedar is there. Hiren, please
sir. Good
ask them
evening.
question.
Yes, sir.
Huh? Okay. Bridges, start. Whoever is answering, you must answer in like 6 different headings. First of all, the identification of an instrument, name of the instrument, then description of the instrument, the material which is used, sterilization, and then the uses. Dr. Gite, is it okay? This is the way they go?
Yes, yes, sir.
Huh?
Yes, sir.
So
That is
please-
ideal.
Yeah. Okay, so identification of the instruments, name of the instrument if it is there, right? Description of the instrument, then the material from which it is made. The next will be sterilization, and then the uses. Okay?
Yes, sir.
17 French cystoscope, sir.
Uh,
Cystoscope sheath, sir.
so
Yeah, go ahead.
It is a 17 French cystoscopy sheet, sir. With the markings over the sheath visualized of at 1 centimeter interval from 10 centimeter from the vesicle end, with outlet and inlet for the fluid, and number 5 indicates the maximum ureteral catheter size which can be passed through this sheath. And in the below photo, it is with an obturator most likely, because it is connected to the sheath with the lock mechanism.
Yes, sir.
Mainly used for female cystourothroscopy, and sterilization, sir, would be for the ethylene oxide sterilization, sir.
Why ethylene oxide? Can it not be autoclaved?
It can be autoclaved, sir.
It can be
Autoclavable.
autoclaved, sir.
Can you not
It
do
can be.
plasma sterilization?
Plasma can also be done, sir.
Then why not
Plasma
doing
can also be-
ETO? How much time ETO takes? How will you turn around the instruments?
Yes, sir. Autoclavable also, sir.
Yeah, then. And you never mentioned about the color coding of the instrument.
Color coding, sir.
Yellow.
Yellow for the 17 French, sir.
You have not given the description of the instrument, number 1. Number 2, you are saying there is an inlet and outlet. Which one is inlet and which one is outlet?
I mean, it can be used interchangeably, sir.
Pardon?
Can be used interchangeably, sir.
There is no outlet,
So-
beta. It is
There is
only inlet.
only inlet.
Then what is the length of the instrument?
So the
What is the
length.
front? What is the size? What is the shape of the front? It is
So,
there is a beak, you know.
So there is a beak in the front of the sheath, sir. And being a 17 French sheath, the beak is a smaller size, smaller in length, of around 2 centimeter, and the color coding is yellow, and yes, sir.
Then
Length
what's
will
the
be of
meaning?
30 centimeters, sir.
Length of the sheath would be around 22 centimeters, sir. And 22 centimeter for the sheath, 10 centimeter in the towards from the vesical end, it will be free of markings, followed by markings for another 12 centimeter at 1 centimeter intervals.
Now, what is the meaning of this 17 and below that there is a 5 and below that there is a 0?
So 17 indicates the sheath size, sir. It is the outer circumference of the sheath, 17 French. 5 indicates that only a single channel bridge could be attached to the sheath, which will accommodate maximum size of 5 French ureteric catheter. And 0 is for the orientation when we connect the bridge to the sheath, sir. So coinciding both the zeros on the sheath and the bridge for proper orientation of connection.
Now, why you are saying 5 French ureteric catheter? It can be
Sir,
5
it can-
French, any
it can
instrument.
admit-
Any instrument,
Yes, sir. It
but the
can admit
maximal
only 5
size,
French, sir.
only 5 French will be the maximum which it will accommodate.
Yes, sir.
And
And made
usually
up of stainless steel alloys.
yeah. So what are the different color codes?
Based on the dimensions, sir, 17 French is green, followed by 19 French, sir, of so sorry, 17 is yellow.
Yellow.
Yellow. For 19 is green, 20 is red, 22 is blue, and 25 is white.
And which is the smallest one? 17? Or there is
17 for
anything? Any others
for-
smaller than that is available or not available?
Pediatric
for
scope.
pediatrics, sir.
Pediatric scope is available, sir.
And MI and even mini perk, sir, mini perk sheath.
No, we are talking of the cystoscopy. Okay.
Pediatrics. Yes.
So now tell me, okay, what are the uses of different sizes? Why there are different sizes?
So depending upon the use, the sizes will vary. For example, for a 17 French, if we are wanting to do a female cystourothroscopy, a 17 French could be used. For if we are wanting to do a stenting or an upper
1
tract,
second. That means in a male you cannot use 17.
we can use, sir. We can use.
We can use, sir. We can.
You don't want to do plain cystoscopy with 17 sheets?
Diagnostic cystourethoscopy can be done.
Diagnostic cystoscopy can be done.
Okay.
I feel, with the uses of the instrument, you should tell the limitations also. So 17 French has some limitations.
Sir,
Uh,
water flow will not be that great in 17 French cystourethoscope, sir.
Also, channel size is small. You cannot do
Sorry.
much with that.
Channel size is small, and if so, the instrumentation or any intervention we are doing will be maximum of 5 French, not beyond that. And along with it, only a single channel bridge can be connected to it, sir.
Yes, sir.
So that might also affect our procedure. Say, for example, if you're taking a patient for stent exchange, then with a single bridge, it would be a bit problematic in a male patient. Hello.
Okay. So now tell me the uses of this cystoscopy sheath. Who is answering?
Sir, with the cystoscope sheath, we can able to retrieve the stone fragments, sir.
Can you tell me it's very simple, diagnostic and therapeutic. So
Yes, sir.
in
Diagnostic
which
and
are the
therapeutic.
cases where diagnosis you will make?
So, diagnostic cystourethoscopy can be done with the 17 French. For therapeutic, based on the intervention which we are intending to do, the sizes of the sheets will vary. Like for
So,
in
so tell
case,
me first the diagnostic. No? Tell these are the 1, 2, 3, 4, 5. Then when you're talking of therapeutic, you can say that this particular sheet can be used for this particular procedure, like that.
Right, sir. So, in cases of if the patient has presented with hematuria, we want to do a diagnostic cystoscopy for that case. Followed by in patients of CA bladder for whom we would like to do a check cystoscopy. This sheet can be used for diagnostic purpose. It can be
Go very
interchanged another.
systematically. Go systematically. You cannot do any diagnosis in urethra.
Sir, in case of stricture urethra, we can able to locate the site of stricture, sir. And also we can able to identify any urethral calculus, sir. Then we can able to identify any prostatic enlargement. We can able to identify bladder neck elevation. We can able to identify prostate enlargement. We can able to identify any tumors in the bladder. We can able to identify any abnormality in the ureter. And we can able to identify any calculus in the bladder, sir.
Pankaj bhai, Gite sir, can you just guide them?
Yes, I think, sir, what he's saying is right. Means you should just say that for any disease where you of urethra, prostate, and bladder, a diagnostic cystoscopy, wherever indicated, you can use the 17 French sheath. And then the indications could be from obstruction, infection, suspected malignancy, evaluation of hematuria, evaluation of positive cytology, and many other conditions. I think this is a very broad question where it will be impossible to really make the complete list. But this is how you should answer. I think you have given the correct answer. One thing which I was a bit amused, I don't know who was answering that time. You were repeatedly segregating the indications based on male and female. You said it cannot be used for a male DJ stenting and it can be used for a female cystoscopy. What was that?
No, sir, it can be used for even male scopy and male stenting, sir. The only problem is the size with which can with the 17 French sheet. So maximum for 5 French could be accommodated. So that is
5
the
French
only
accommodated. Okay, you mean the instrument channel is 5 French?
5 French, yes, sir.
Okay, so how will that make a difference between male and female?
No, sir. It will not make a difference, sir. So it can be used in both the males and females both.
I thought you had said it is used for female cystoscopy, so that I'm asking. Yeah.
Okay. Yeah. Sir, bolu.
Yeah, please, doctor.
Yeah. So 17 French cystoscope is called as a female cystoscope. There is a reason behind that. Because rest of the cystoscope sheath has a long beak.
Leakage of the fluid.
If you use that long beak inside the female urethra, the urethra is short. So the leakage of water is more and vision will be poor. That's why the 17 French sheath come into existence. Because his sheath beak is small, leakage is less, so more useful in female. That's why it is called as female.
So the possibility of the urethra getting distended is higher because the irrigation is an end irrigation.
And another thing is that color coding is not fixed. Color coding is as per the company. Okay, so if you go to the stars, and star 17 is green. Okay, so while telling, when the instrument is in front of you, you should make this instrument is of make dash company.
Okay, sir.
उसके ऊपर लिखे वाला रहता है.
Yes.
अब फिर उसके बाद में फिर कलर कोडिंग आएंगे. Another use you have missed is you can measure the prostatic length.
Prostatic.
Yes, sir. Yes,
okay, if the same scope is used in the prostate of a male, देन प्रोस्टेटिक लेंथ कितना है ये गिनने के लिए उसका यूज हो सकता है. बाकी नंबर ऑफ यूजेस वी हैव ऑलरेडी टोल्ड.
Yes, sir.
Then the instrument below is not only a obturator, it is an assembled instrument along with the sheath.
Assemble. Yes.
You initially
Yeah.
told down is the obturator and up is the sheath. So down is the sheath with obturator.
Sheath with obturator. Yes, sir.
Yes, sir.
Now, one more thing. You have talked about the therapeutic diagnostic. I want you to tell the therapeutic. Of course, it is a very wide subject, but the reason is that we don't want you to miss anything, even if like in theory or when you are answering. So out of 10, even if you say 7, 8, we are happy. Okay.
Yes, sir.
So tell us now
Yes,
the
sir.
therapeutic uses.
So therapeutic, it could be whether for a DJ stenting, stent removal,
See, you can say, sir, we are not talking, I am not telling about a 17 French sheet only. I am talking
Okay.
in general about any cystoscopy sheet, and the
Okay.
therapeutic uses are 1, 2, 3. Like you can start.
Okay, sir. So in general, sir, therapeutic uses for cystoscopy sheath could be DJ stenting, stent removal, cystolithotripsy, for evacuation of the stone fragments after cystolithotripsy, sir. Then
With the cystoscopy guidance, we can able to catheterize also,
yeah,
sir.
achieving with the help of the achieving a suprapubic tract under vision with that.
We can able to evacuate the clots.
Clot evacuation, yes. And yes.
Yes. Sir.
Yes. All the uses start from the urethra and go inside and tell us that you can bypass the stricture by ureteric catheter. Yes or no? Then
Yes,
if
sir.
there is a bladder neck obstruction, again, that also you can use it. Go inside.
Yes.
As you said, very rightly, clot evacuation, foreign body. You can do cystolithotripsy.
Yes.
You can do laser. You can use laser to break the stone.
To break
right?
the stone.
Again, it can be
Yes,
used
sir.
for HOLEP also.
Yes, sir.
Then for URS or PCNL, first you do cystoscopy, put the guide wire, ureteric catheter, dilatation.
Yes.
Yes.
Yes, sir. We can able to balloon dilate. Yes.
Just think of, as you said very rightly, clot evacuation, doing in everywhere you're going. Then you want to do therapeutic, this thing, bilateral RGP for
upper tract instrumentation, sir. Ureteric catheterization, DJ stenting, RGPs, initial wire access to be taken before inserting access sheets for RIRS procedures, clot evacuation, cystolithotripsy with stone fragment evacuation.
Yes. So, okay. Gite sir. You want to ask them about any other procedure, like how they will do cystolithotripsy or how they will do the clot evacuation if it is needed?
Oh, no, sir. We will go instrument by instrument. That will cover the procedure. अभी शीत है तो उसके बाद में अपन ब्रिज पे जाएंगे, एक एक एक
Okay,
करेंगे।
fine. Okay, Brijesh, go ahead. Bridge, show them bridge.
Why there are two bridges? Are both these bridges same?
No, sir. No, sir.
Why? What is the difference?
So there is no instrument channel in the first one, whereas the only telescope channel.
While the other one can able to admit instruments, sir.
You are missing something, no? Look at the length of both the bridges.
Short, and this is a long one.
Why there is a long bridge? Where is it used? VIU sheath. So
Okay.
usually VIU sheath is used with working element. But if you would like to use the VIU sheath after going in and you want to change it and do a formal cystoscopy, you have to have this long bridge. You
Yes,
cannot
sir.
attach the cystoscopy bridge. It will never fit there. The telescope will come out. So
Okay,
you
sir.
must be aware that there is a long bridge which fits on the VIU sheath.
Yes, sir.
जैसा सर ने बोला है कि यू शुड डिस्क्राइब फर्स्ट द नेम ऑफ द so it is a bridge, so you describe then what are the type of the bridges. So if it is detachable and integrated with the telescope, these are the 2-1 classification. Another classification is without side channel, with one side channel, with two side channel. Then if it is without side channel, then it can be used only for the scope. If with one channel, then it will be with one is for the telescope and another is for placing some
instrument.
Instruments. Then another bridge is two side channel. Then short bridge and long bridge. ये हो गया उसका क्लासिफिकेशन. उसके ब्रिज के जो पार्ट्स है उसमें हर एक का नाम है.
Yes, sir.
जीरो मार्क कहाँ पे है, वो एरिया क्यों जीरो मार्क पे, नॉब पीछे क्यों रहता है, वो उसको फिक्स कर वो क्यों है, इंटीग्रेटेड के बेनिफिट्स क्या है, ये सब चीजें एक वन गो में अगर बोल दिया कि वो एग्जामिनर ज्यादा क्वेश्चन पूछेगा ना. So what is the benefit of detachable bridge? बोल.
The bladder empty. We can empty the bladder when required. Also, sir, in if you want to evacuate something like a clot or a stone fragments, then with a detachable bridge, an evacuator can be connected, sir.
Correct. और so why there is need of integrated bridge? Integrated telescope, I mean, bridge attached to the sheath.
To the telescope.
You can remove a DJ without removing the sheath, no? If there are two DJs, you can remove one DJ and then remove the other one also, rather than doing two cystoscopies.
Yes, sir.
तो ये सब चीजें रूटीनली हर जगह पे होती है, वही बताना है.
Yes.
तो आप और बताओ ब्रिज के बारे में क्या क्या बता सकते हैं, कुछ पढ़ा होगा.
Bridge, sir. Standard bridge length is of 6 centimeters, sir.
6 centimeters.
Again made of stainless steel, with mainly 3 parts. The knob which connects with the sheath, the telescope channel, the working channel, and the proximal knob which gets connected to the through which the scope enters, telescope enters.
बराबर. Anything, sir?
And
पंकज sir, और कुछ ऐड करना है ब्रिज के बारे में तो?
there is one modification which can be there is the Alvarez lever bridge, in which the working channel can be deflected.
What was the role of Alvarez bridge?
Sir, if to make so the working channel can be deflected to make in line with the ureteric orifice if it was a difficult cannulation of the ureteric orifice, so to make that in line. So for that very reason it was used.
So have you seen an Alvarez bridge?
No, sir.
Why is it not used today?
Be flexible.
Flexible with the flexible.
So these equipments were important when the field of vision of the telescope was very narrow. So to
Okay, sir.
turn the telescope towards the orifice, and especially with a large median lobe, would be very difficult. But today, with the expanded view of the telescope, these equipments have become redundant.
Okay, sir. Okay.
I think we can proceed further.
Yes, sir. Next instrument. तो पहले वाला रख दो, वो यूजुअली रखते हैं. हाँ, yes.
So this picture depicts an integrated system of a sheath with bridge and a telescope, sir.
Why you are telling it is integrated?
Integrated as in connected. Connected.
Assembled.
Assembled, ready to use cystoscope.
Yes. Yes.
अभी ब्रिज और शीत हो गया, अभी टेलीस्कोप बच गया इसमें का. बता दो टेलीस्कोप.
So telescope is, sir, the parts visible of the telescope in this are 1, 2, and 3, sir. 3 being the light pillar. Yes.
3 is a light pillar, sir. 1 is a eyepiece. 2 is eyepiece, and the 7 is a irrigation channel where you can able to control. And 4 is the size of the scope, size of the sheath, and number 6 is number of French admitting 2 instruments or 2 instruments. Number 5 is irrigation channel, sir.
तो नेक्स्ट टेलीस्कोप का पिक्चर लगा दो. Yes, describe.
Green one is a 0-degree telescope, and that orange one is a 30-degree telescope, sir.
और पूरा डिस्क्राइब करो. अब एक क्वेश्चन पूछने के लिए मत बोलो. 0 डिग्री मतलब क्या है? व्हाई इट इज 0 डिग्री? व्हाट इज एंगल ऑफ विजन? व्हाट इज द फील्ड ऑफ विजन? उसका क्या यूजेस है? ये सब चीज, लेंथ कितना है? एक बार शुरू हो गया कि बंद नहीं करने का, खत्म होने तक.
30-degree scope is used for diagnostic cystourethropy, sir. Used for routine cystoscopic diagnostic cystoscopy, sir, and able to we can able to do DJ stenting, sir, and we can able to do DJ stent removal also in.
So
Sir, just said you go systematically, no? You
So
talked
these,
about you only told about the 30-degree scope, and then you have gone to cystoscopy and the
so,
uses. What is the instrument? What is the field of
so,
vision? Why is it called 30 degrees? What material it is made out of? That light pillar has got three types of attachment for different types of light sources.
that's it.
What type
So
of rod length system it is? How is it sterilized? Where is 0 degree used? Where is 30-degree used? Then you tell all the different procedures. No, directly clot evacuation, this, that, digest stenting. Any instrument
so
has to go in that order. If you don't remember this order, then every time we are not going to tell you what is the instrument, what is it made out of, what are the characteristics of the instrument, how is it sterilized, how is it assembled, what are the different parts of the instrument, and then uses and limitations.
Agreed.
So this image shows a 0 degree telescope and a 30-degree telescope.
But what are
The
the degrees? 0 degree, 30
so
degree,
0 degree
70
zero
degree.
degree means 0 degree means that the lens is straight in line. It is not angulated. So it is mainly used for a tubular for urethroscopy. So straight in line vision. Whereas a 30-degree cystoscope has an angle of the lens in the front of 30 degree. So basically, it can be rotated to view the lateral surfaces of the bladder. So that is basically for the with regards to the degree. The size of this telescope is of 4 mm with a standard
देखो
length
देखो,
of
लिसन लिसन लिसन, अभी तो बहुत सारे डिग्री बच गए ना भाई.
सर ने
70
पूछा विच
degree,
वाला था डिग्री, तो बोलो ना
अभी
70, 30,
डिग्री का
7,
0
120.
12,
0 degree means if you want to say
7,
straight front, and if you don't want to see aside, then it is 0 degree. That is
0
luminal
degree,
vision. Luminal vision.
luminal vision.
So it can be used in the lumens.
Yes, sir.
That means it is used in the urethra.
Urethra,
When if you want to do a scopy in some hollow organ like a bladder, then
bladder.
you want to see on right side, on left side. So that
So
is the 30 degree.
30 degree.
Angle of
Fol-
vision, 30 degree here and 30 degree there from center. Okay,
Followed by
that is a field of vision, sorry, field of vision.
pillar.
And angle of vision is 30 degree only.
30.
So that is for posterolateral area. Then comes is a 70 degree. It is for
Called
the
dome,
dome of the
dome
bladder.
of the bladder.
Then
And
comes
for
120 degree.
one,
That is
bladder neck,
anterior surface of the and neck of the bladder. So
bladder
ये
neck.
डिग्री के हिसाब से बोल दे कि वो डिग्री खत्म हो जाती है, फिर नेक्स्ट पॉइंट पे जाने का टेलीस्कोप के. एक पॉइंट पूरा खत्म कर दो, हो गया एक पॉइंट.
Yes.
दूसरा पॉइंट बोलो.
So yes, sir. So with regards to degree, that was 70 degree for the dome and 120 degree for bladder neck. Now the basic dimensions of the telescope. It is a 4 mm telescope and a standard length of 30 centimeters. Uh, Followed by the system used is the Hopkins rod length system, which is used for the vision, and uh, again it has a color coding based on the degree. Size of the telescope generally remains standard. It can be attached to any size of the sheath with a standard bridge. So that is the size doesn't change. And the light connectors will depend upon the the make of the scope and the light cable. So there are adapters which can be used for connecting the light cable.
अगर कोई एग्जामिनर डिटेल
पूछ सकता है, तो इसमें फिर वो तुमको कन्वेंशनल रॉड लेंस सिस्टम, हॉपकिंस 1, हॉपकिंस 2, देन व्हाट आर द बेनिफिट्स ऑफ हॉपकिंस 2, ये सब चीजें पूछी जा सकती है। और थ्योरेटिकल
Number of
कोई थ्योरेटिकल आदमी आया ज्यादा है तो ये भी चीजें पूछ लेगा। देन व्हाट आर द
Yes.
बेनिफिट्स ऑफ हॉपकिंस 2 वो पूछ सकता है।
Yes, sir.
Hopkins 2 number of glass rods is more when compared to Hopkins 1. Hence, the vision is much better when compared to Hopkins 1, sir.
So in terms of brightness,
So,
resolution,
and the air inside is reduced. So as the
Glass rods are increased.
glass rods increase, so one is basically for the image transmission, the other is for the light transmission.
so benefit क्या रहेगा?
So better quality vision, sir, and the angle is wide.
So better resolution, better brightness,
Right.
okay. और वो
Yes,
सिस्टम ऑटोक्लेवल भी हो जाता है आपके
Autoclave.
2 में, बराबर है। ये 2-4 पॉइंट अगर बोल लिए तो वो ज्यादा पूछेगा नहीं। फिर एक तो ऑटोक्लेवल है, ब्राइटनेस अच्छा रहेगा, रेजोल्यूशन अच्छा रहेगा,
Yes.
Yes, sir.
और रॉड लेंस सिस्टम का ये पता रहना चाहिए कि कौन सा रॉड, फिर कितना डिस्टेंस, कितना कौन सी सिस्टम कैसे चेंज होगा, ये थोड़ा थियरी पढ़ लेना।
Yes, sir.
और कुछ एडिशन है टेलीस्कोप में तो सर प्लीज पंकज सर, गौरंग शाह सर।
It's okay. Okay, क्या पूछा है?
So then we will go ahead. अगर वो
There is a something like as a wide angle and narrow angle. Can you ask them about that?
बोलो, sir is asking wide angle and narrow angle telescope. Sir is asking narrow angle telescope and wide angle telescope.
Sorry.
I don't know, sir.
See, earlier now we used to get a narrow angle, means the vision was, I think it was only 30° all around. Now with a wide angle, it is 60°. So
Okay,
if
sir.
you are taking 0°, okay, 0
Yes,
is
sir.
in the center, then all around you can go, you can see up to 60°. But
Okay, sir.
one, I think we'll have to find out, confirm it. I tried to find out on literature also, but I'm not able to get it. But somewhere I read it about that. So earlier scope, we had a very narrow vision. Nowadays,
sir.
we are getting wide angle.
Sir, if I
Okay.
remember it right, narrow angle is when it is 90 degrees.
No, sir.
Yeah.
The narrow angle and wide angle concept is when a conventional system is used for making the telescope. In that, the angle is narrow because that rod length is the air spaces are not there in conventional, and here the air spaces are there. So the angle is wide in a Hopkins 2 or Hopkins 1, and जो conventional system है उसमें narrow angle था। narrow angle मतलब जितना सामने है उतना ही दिखेगा। अगर 30° टेलीस्कोप ले तो 30 ही दिखेगा। Hopkins 2 में एंगल सर जैसा बोल रहे कितना ज्यादा दिखेगा ये कहीं पे लिखा नहीं, लेकिन वाइड एंगल मींस Hopkins 2।
I agree with that part.
Hopkins too.
Yeah, Hopkins 2 becomes wide angle. But what I remember, and I am subject to be corrected, you people may please reconfirm what I'm saying, is when you say narrow angle, then the field of vision is 90 degrees like this. Means if I look at 0 degrees, my 0° will bifurcate the field of vision in 45 degrees above and 45 degrees below. But in wide angle, it becomes 120 degrees. So 60° above and 60° below. Same way, if we look at 30° telescope, then in narrow angle, it will be, say, So 45 and 15. So that way the field will be bent downwards by 30 degree. And it remains 120 degree in wide angle. So the field of vision, I believe, is 90 and 120, but please reconfirm this.
Yeah. What you are saying is right. The only thing is the new one I know it is 60 degree, means 0 degree, left hand side, you can say 60 degree, right hand side, above, below, all 60 degrees. So as you are saying very rightly, it is 120.
Full view becomes 120
Yeah.
degree.
And the older one, I am not sure whether it was 45 or 30. One has to confirm it. So exactly what you are saying. So if it is a 30 degree, then down 30 degree is the center. 60 above that means from 0, it will be only another 30 degree. And down it will be 30 plus 60. So it will be 90 degree.
So total will remain
Correct.
90 degree.
Yes.
तो ये सब चीजें ध्यान में रखना है. दो चीजें, व्हाट इज द एंगल ऑफ विजन एंड व्हाट इज द फील्ड ऑफ विजन. कन्वेंशनल सिस्टम एंड हॉपकिंस 2 में क्या डिफरेंस है वो भी पक्का ध्यान में रखना है. और चेंजेस कैसे हो गए हैं और क्या लेंस पुराने इसमें लेंस बोल के दो क्या एक्ट करता था और अभी लेंस बोल के क्या एक्ट होता है और उसकी वजह से कैसा एंगल चेंज हो गया. और ये सर ने जो अभी बताया है वो सब कैलकुलेशन भी ध्यान में रखना है. तो सो दैट कि उसमें ज्यादा डिटेल में भी अगर कोई गया तो एटलीस्ट यू हैव टू एटलीस्ट वी विल गो थ्रू दैट.
Yes.
Sir.
One favorite question at our time used to be, how will you insert a cystoscope with a 70 or a 120 degree telescope?
So we will first do the cystoscopy with 30 degree or a 0 degree, and then we will change the telescope.
Yes. So you cannot go through the urethra with 70 or 120. You have to place through the urethra with a routine 0 or 30 degree and then exchange the telescope. Good.
तो सीधा बोल देना 0 degree. I will use 0 degree for urethra for entering inside the bladder, replace with 30 degree for accessing the bladder, and the area if it is not accessible by 30 degree, if required, I will go for 70 and 120.
Yes.
Yes, sir.
Shall I think let's move forward.
Flexible grasp.
Yeah, who is answering?
It's a flexible grasper, sir.
Flexible grasper. For removal forceps with the tip having serrations, like likely to be an alligator type of a grasper.
So flexible biprong non-tooth metallic grasper.
Okay.
Yes, sir.
Used for
Stent removal, sir. And for grasping, retrieving calculus, sir.
usually you would not use a flexible such flimsy forceps for that.
Yes, sir.
So this is predominantly used for stent removal only.
Yes, sir.
Are you aware about the size of this equipment?
French. 5 French, sir.
Sir, five French, sir.
I think it is 6, but I think it is 6 French.
Okay, sir.
5
Yes,
है या
sir.
6 है डॉक्टर? 5, okay. ठीक है. I don't think there is anything else here.
Alligator forceps, sir.
नहीं सिस्टोस्कोपी में सर वो ब्लू लाइट व्हाइट लाइट वो भी वहीं पे भी वहां पे भी वाइवा जा सकता है अगर सिस्टोस्कोपी के ऊपर पूछ रहे हैं तो
biopsy forceps, sir.
which biopsy
Bladder biopsy.
Bladder biopsy.
Can't it be used in urethra? So instead of saying bladder biopsy, say rigid punch biopsy.
Rigid. Okay.
Rigid.
Okay. You don't need to specify that it is used for bladder.
Yes.
Okay.
Okay.
So what is the difference between these two?
So this has a cup as in the forceps and the ends, the prongs. It has a cup shape, so it will whatever lesion we are trying to biopsy, it will grasp it. Whereas the biprong forceps or the grasping forceps, it has serration. So for better firm grip of a stent to hold that. Sir. That is the basic difference. And this is a rigid. That was the flexible one, sir.
Why is there this cup? In the biopsy forceps, why do you have that cup?
Sir, to hold on to the lesion and to prevent the bladder mucosal.
So the another one also, another.
So it is there so that the tissue doesn't get crushed inside your forceps.
Forceps.
Yes, sir.
So the cup has slightly sharper edges. So those sharper edges will cut the tissue, and in between that cup, the tissue doesn't get crushed or compressed.
Yes, sir.
So it is like doing a punch biopsy. That cup is like for the punch biopsy. It is like that particular area is cut all around and which is accommodatable in that gap, that only will be removed. So the tissue will not be get stretched, will not be get torn.
Yes, sir.
This is the
Straight Otis Mormaios
Urethrotome
Urethrotome, sir.
with the Otis
Otis
blades.
Mormaios Urethrotome with knife and a graduation scale, sir.
Why did you specifically say straight? Means is there a curved Otis also?
Curved Otis Urethrotome is also available, but it is not predominantly used, sir.
Okay, I have not seen, so I'm not aware of it.
Yeah, I have also not seen.
To the best of my knowledge, it is available only as a straight for urethrotome. And frankly, means even logically, I would feel that there is no need for a curved urethrotome.
Okay, sir.
Because you are going in a straight tubular lumen. I don't know where you would use a curved urethrotome.
So the
If you are telling about the tip, it is available. There is one other, we have got one where the only tip is little like, to negotiate curve.
Yes,
but
sir.
no
Yes,
one
sir.
is using it.
Yes, sir.
So the knife, sir, here it goes inside the groove, and generally it is not to be when it is completely fit inside the groove. It is not to be seen from the above. The graduation is the calibration is from 15 to 45 French for this Urethrotome. So it can be dilated to 45 French, and there is a holding channel, thumb holding channel with the knob on the top and the graduation scale. Then there is the straight Urethrotome with the groove in which the knife passes. Sir.
So what is the mechanism of action? Means what exactly does this do?
So
It dilates the urethra, sir. It can
So it
able
is
to
a
accommodate. It helps in accommodating the sheath before doing a transurethral resection of prostate,
so
sir.
the mechanism here is that the knife causes a linear cut on the urethral mucosa, sir, and so dilates according to the calibration which we have prefixed. So for basically trans urethral resection procedures, so depending upon the outer sheath size, we can decide the calibration which we want.
So if you're going to use a 24 French sheath, then how much would you open the Otis Urethrotome to?
26 French, sir.
26, sir.
For a 24 sheath, how much did you say?
26, sir.
Okay. Again, I think it should be 3 French more than the sheath that you are using, not 2 French more.
Okay, sir.
Okay.
Agreed, sir.
And second, it does not cut the mucosa. It only cuts the places where there is a fibrotic ring. Okay. Any tissue which is supple, that will not get cut by the Otis Urethrotome. As in your description, you said the knife, it goes inside. If you press on the knife with your thumb, the knife dips inside. But
Yes, sir.
only when there is a tough tissue, then it would cut. If it's a soft tissue, it would not cut that. So it does not cut the mucosa, it only cuts open the fibrotic rings. And I don't think you should use the word dilatation here. This is more used like a calibration and to cut open the urethra. Dilatation is a completely different procedure. In dilatation, you create circumferential multiple cuts in the wall. So you have separate dilators, which are Cletons and other types of dilators. So this is not a dilator. This is a equipment to calibrate and to cut open the urethra with a single cut.
Yes, sir.
Yes.
What is the advantage of using this equipment? Advantage and disadvantage?
So the advantage is that in cases of narrow urethra, it can help us to with the it can help us to create a lumen size of a desired lumen size based on the procedure we are wanting to perform, and it can cause false passages if not inserted. It can damage the urethral mucosa and can create false
So
passage.
trauma and bleeding are the two probable
Bleeding.
disadvantages.
Yes.
And advantages, as you rightly said, it would open up the urethra so that there is no friction between the sheath and the urethral wall. The compression on the urethral wall is less, ischemia may be less, and hence the long-term stricture may reduce.
Prevents meatal stenosis also.
True. How long
You will
inside
use
would
it
you
for
put
the
this Otis Urethrotome? What distance should you cut?
Pardon, sir?
How much inside would you put in the urethra?
Otis Urethrotome, how much inside you will put, right up to bladder, to prostatic urethra, bulbar urethra, only anterior urethra.
Tell us what you see in your day-to-day work.
Yes.
So
Only and
first is, sir, it has not to be forced inside while doing. The first step is that. So, and we have to hold the urethra the penis and urethra completely straight taut while during before insertion, and the bladder has to be distended, not empty while doing this.
Why? Why it should be full? Bladder should be full.
Sir,
That means you are
in
going to
empty
put it inside the bladder.
no, sir. So in
Then
order to
What will happen if you put inside the bladder? What wrong thing will happen? Or nothing will happen. It will go inside like a dilator because it is not open.
yes, and it is rounded in at the tip, so it is not a traumatic one. But it is used for what? Distal part of the urethra or the proximal urethra?
distal mainly.
Distal.
So you will put it up to what? Only anterior urethra or up to bulbous urethra?
Proximal to membranous urethra.
Distal too.
Proximal or distal?
Distal to membranous urethra.
Yeah. So you are going to cut mainly the penile urethra, correct? Fine.
Yes. Yes, sir.
You can you do Otis? I mean, can you do VIU, visual internal urethotomy, or
Otis urethrotome is not used for cutting anything normal. Already sir has told. It will cut only the narrowed or fibrotic or ring area, and that cutting is only up to 3 millimeters. So the chances of bleeding here, if you stretch right up to 45 French, then it will bleed. If it is required to stretch up to open up to 26, and if you open up to 45, then it will definitely tear and bleed. But if you open up to the required French, and if you just pull that blade inside, it will cut only 3 millimeters. So chances are bleeding is less. One thing. If you put inside the bladder also, nothing will happen.
Okay, sir.
Okay, sir.
No incontinence will not happen. Nothing will happen because that cut is 3 millimeters at one place. And if that particular area is normal, why it will bleed for 3 millimeters? ऐसा है तुम सिस्टोस्कोपी करते करते तो 3-4 जगह पे एब्रेजन हो ही जाते हैं.
Yes, sir.
So this particular instrument is used only as a prior urethral preparation for some procedure which is for a longer duration.
Yes, sir.
Yes, sir.
Okay. So it is again a channel. I have not seen a curved Otis urethrotome, and I have not read also. But channel is there. One central channel is there. Through that wire के ऊपर भी डाल सकते हैं इसको. ऐसा इंस्ट्रूमेंट है. तो क्या यूरिन आए वाला पता चलता है. लेकिन कर्ड तो हमने नहीं देखा है, कहीं पढ़ा भी नहीं.
Yes.
And uses you already described.
Yes.
If anything wrong, Pankaj sir, please add.
Yeah, absolutely correct, sir.
so my question is, for a distal urethra, that is penile urethra, will you
Yes.
like to do VIU or you don't want to do?
No, sir.
No, sir.
Why?
The first is there
daughter-
is
We might tend to injure the nerves, sir.
कुछ भी बोलते हो क्या? Why will you injure the nerve? देखो, optical direct visual internal urethotomy using a cold knife, direct visual internal urethotomy using a laser. ठीक है? These are the two ways of doing the direct
internal urethrotomy, visual internal urethrotomy. So site. So what is the ideal site for doing the urethrotomy? The site is definitely a bulbar urethra.
Bulbar urethra
Not
short.
above, not below. Bulbar urethra.
Yes. Yes, sir.
Yes, sir.
Why not in the penile urethra?
Sir.
Can it be done in penile urethra or not?
No, sir.
Why?
No, sir.
Why?
See, you can do, but you should not do. Why? Why you should not do it? See, first of all, it is not a fixed part, right?
Fixed.
So when you are cutting, you may not be able to cut it exactly in the midline. And on
Yes,
the
sir.
either side, there are blood vessels, arteries. So you may damage 11 and 1 o'clock. Number one. Number two, our purpose is what? Only to cut 3 millimeter. But here,
Yes, sir.
you will cut it more. And there may be extravasation of fluid also.
No,
Right? So these are the three important things. We don't want to use it for penile urethra.
So don't confuse Otis urethrotomy with VIU. Otis urethrotomy is totally different. That will cut 3 millimeter, agreed. In VIU, it is up to what level you will cut? When you will say yes, it's okay. इससे ज्यादा नहीं करना है. क्या देखेंगे वहां पे?
So the fibrosis has been cut, and if whether we are smoothly able to negotiate the scope proximal to it with the sheath.
और ज्यादा फाइब्रोटिक रिंग है नहीं नेगोशिएट किया तो
Pink bulbosa.
Pink, yeah, pink, and slight bleeding.
बूजिंग शुरू हो गई कि समझ लेना कि नॉर्मल एरिया आ गया.
Normal आ गया.
अब
Slight
उसके
bleeding.
आगे जाएगा कि नहीं जाएगा स्कोप तो हमको भी पता नहीं है. वो एरिया कितना लेंथ का है स्ट्रक्चर का और सच में कितना पेरी यूरेथ्राइटिस कितना है, ये सब उसके ऊपर डिपेंड है. तो इसके लिए बल्बार यूरेथ्रा शॉर्ट सिगमेंटल स्ट्रक्चर, सिंगल स्ट्रक्चर. शॉर्ट सिगमेंटल मतलब क्या? लेस देन 1 सेंटीमीटर.
1 सेंटीमीटर.
ओके.
Yes, sir.
तो ये आइडियल
Yes.
सिचुएशन है. अभी ये हो गया लेजर प्लस कोल्ड नाइफ का. उसके साथ अभी जैसा अभी नया चीज आ गई, उसके साथ ऑब्जेक्टिव ट्रीटमेंट भी अभी यूज हो रही है. तो ऑब्जेक्टिव ट्रीटमेंट में बहुत सारी चीजें है और रिजल्ट कंपेयर टू प्लेन डीवीआईयू इम्प्रूव्ड रिजल्ट है, ऐसा लिटरेचर है. लेकिन एज फार एज मी आर द पर्सन हु डज रेगुलर यूरेथ्रोप्लास्टी, देयर इज नो रोल ऑफ VIU. And where is if there is a role of VIU, that can be replaced with non-transecting uretroplasty.
Yes, sir.
If it is very filmy, like a wall, then it will be, there is no need to do a VIU. That can be dilated.
Dilated.
So dilatation, VIU, and non-transecting, all three are
Yes.
for same indication. And the best result is with non-transecting. Dilatation and VIU is palliative treatment. Theoretically, if in exam, if you ask, one VIU can be done. If that get failed, it is indication for surgical treatment. एग्जाम में 1 VIU बोलना है, लेकिन स्ट्रक्चर का लेंथ 1 सेंटीमीटर से कम चाहिए, बल्बार चाहिए, सिंगल चाहिए.
Yes, sir.
Yes.
Okay. So what are the different types of blades you know?
Sir is asking about VIU blades.
So, VIU, sir, straight, then curved, serrated,
Triangular, serrated, and circular.
circular.
These are the three available. Okay. So
Yes.
when you are going to use this particular one?
We're going to
When there is you are suspecting the rigid urethra. If it is a supple urethra but not, and you just want to make it little bigger, then curved one. Otherwise, this one.
yes, sir.
Yes.
Okay, Brijesh, go ahead. Start from below.
Yes, sir.
So
Yeah.
the below picture shows the obturator, followed by the VIU sheath of 21 French with markings on it, uh, with a beak which is oval straight, and a channel on the top of it,
And a working element.
and a working element, and a VIU blades. The working element
It's a passive working element, sir.
yes, passive working element with a telescope attached to it.
So first, tell me what are the different types of obturator. This obturator, does it belong to this sheath?
So obturators, sir, can be mainly for three types: the cystoscopic sheath, the resectoscope sheaths, and the for the VIU sheath, sir.
Yes, sir.
And this is a uh, rounded end, non-visualizing obturator, sir.
So it is for a VIU sheath. Okay.
VIU sheath, yes, sir.
Yeah. So describe now VIU sheath. It is in front of you.
VIU sheath, sir, is a standard 21 French sheath, which has markings along the entire sheath length of 1 centimeter. That is mainly to calculate the length of the picture. The beak of the sheath is straight oval in shape, sir. It is not like the cystoscopic sheath. And
So don't say beak. Don't say beak. The distal end.
okay, distal end.
So distal end doesn't have beak.
Yes, sir.
Yes, sir.
And it is of the standard size of 21 French, with a channel attached on the top, and an inflow channel, to which to this sheet gets attached the working element of the VIU.
And what else it has got? On the
So
side.
the top channel for wire insertion, sir.
Yes, sir.
And to complete this sheet, there is also it can be used with a half moon sheet along with this.
How will you sterilize it?
Autoclave.
Autoclave.
You see, sir, most of the instruments, these instruments are autoclavable. So I like to autoclave it. The other methods are, then you enumerate other things.
Yes, sir.
So if you are going to use 2 consecutive cases, how you are going to sterilize?
Chemical sterilization.
So which chemical you use?
Sidex.
Sidex, sir.
So nowadays, which one is preferred? Paras, if you are listening, please explain them.
Parasitic acid.
Paras.
Sir, now there is a flash solution also made of peracetic acid or sodium perborate, which is using which has a time of only 5 minutes for disinfectant and 10 minutes for sterilization, and it has to be reconstituted daily. Sidex use for at least 14 days.
Yes, sir.
Yes.
So in that Sidex, there are chances that every time you are changing the instruments, like you're putting the like bacteria inside, or the sterility part is questionable. Also, the strain may not remain the same like on the first day till the end. And the last thing is you have to make the full solution. So the wastage is also there. Compared to this is better. Okay.
Yes, sir.
Yeah. Now tell us something about the working
element is passive working element, sir. Thumb operated, which has a telescope assembled attached along with it, sir.
So it is a passive working element which is thumb operated, sir. And in this, the blade will remain inside the sheath. So when we operate, when we push the thumb, the blade comes out. So that being the biggest advantage, that the blade or if it is used for the other procedure of a TRP, the loop remains inside the sheath. Whereas in the active, it is finger operated. So it generally stays outside, and when we pull it inside, then it comes in. So that is the main difference between passive and active.
So now tell me that for visual internal or this Urethrotome, which telescope you'll use? And now describe the procedure. How will you do it?
A 0-degree telescope will be used in this, sir, for VIU. And for the procedure, sir, once the sheath and working element have been assembled, sir, we do it can be done, sir. First, we do a diagnostic cystoscopy can be done after observing the stricture. So based upon the length of the stricture and the dimension of the stricture, once we have decided that we are proceeding with the VIU, we'll park a guide wire across it, and with the 0-degree telescope and the blade inside, the VIU cuts can be given at 12 o'clock position, sir. Till the time the fibrotic area has been cut and we see some mild oozing, and we are able to progress ahead proximal to the stricture. So the sheath which has the channel on the top allows us to park the wire across the stricture, sir. Also, if we are using a half moon channel with the sheath, then after completion of the procedure, if there is if we have doubt that the catheter insertion over the wire might be difficult, then we can place inside the half moon sheath inside the bladder, remove the VIU sheath, and on top of it, we can pass the catheter into the bladder.
Which fluid you will use? Which
sir,
irrigation fluid you will use?
it's a normal saline.
Normal saline.
or VIU or for TRP? For VIU you are telling or for TRP? देखो, in the instrument set of TRP, single mistake cannot be accepted.
Yes, sir.
Single matlab single. What is outer sheath, inner sheath? Is there any space between two? Why there is space? What are the sizes of the cystoscope? Then working element, single loop, double loop, active, passive, उसके हर एक के नाम क्या क्या है, वो सब चीजें, उसका बेनिफिट एक्टिव का, प्रोज एंड कॉन्स हर एक के, एक्टिव का फायदा है नुकसान भी है, पैसिव का फायदा है नुकसान भी है, तो ये हर चीज आपको पता रहना चाहिए, इसमें कंफ्यूजन को या गलती को माफी नहीं है।
Yes, sir.
Yes, sir.
कौन सा फ्लूइड यूज करना है, नॉर्मल सलाइन कब करेंगे, ग्लाइसिन कब करेंगे, ग्लाइसिन टॉक्सिसिटी मतलब क्या है, टीआरपी सिंड्रोम मतलब क्या है, मैनेटॉल कब यूज कर सकते हैं, 5% डेक्सट्रोज यूज कर सकते हैं, नहीं कर सकते, अभी फिलहाल रूटीनली क्या यूज हो रहा है हर इंडिया में। तो एग्जाम में 1.5% ग्लाइसिन नहीं बोलना है, हमारे पास अभी भी हॉट वाटर यूज होता है, उसके फिर हर एक के साइड इफेक्ट्स पर टीआरपी सिंड्रोम कैसा अर्ली आइडेंटिफिकेशन, व्हाट इज द फर्स्ट साइन ऑफ टीआरपी सिंड्रोम इंट्राऑपरेटिवली, ये सब एक हर चीज पूछा जाएगी।
Yes, sir.
Yes.
तो यहाँ पे आंसर गलत होने को स्कोप नहीं है। हाइट ऑफ द इरिगेशन, देन स्पीड ऑफ द इरिगेशन, अच्छा विजन रहने के लिए कितना स्पीड रहना चाहिए, कितना फ्लूइड पर मिनट ऑब्जॉर्ब हो जाता है, ये हर ये सब दिए वाला है, तो बुक में दिए वाला है, ये सब पढ़ना है, और ये पूछते हैं, ये क्वेश्चंस कैन बी आस्क्ड।
Yes.
Yes.
एक एक आप आता है तो बता दो कि इरिगेशन कितना स्पीड से रहना चाहिए, कितने हाइट पे रहना चाहिए।
So height generally is
60 centimeters
60
from
six from the table, and rate of infusion for a good
हाइट कितना
vision
बोले, कितना बोला हाइट?
60
60
to 90
centimeters,
sir.
sir.
So it is usually 60 to 100, 60
60
या
to 100.
70 दोनों में से कुछ भी बोला तो चले। नेक्स्ट,
Infusion sir for a good vision sir of around 300 ml per minute sir,
बट नॉट मोर देन 300।
not more than 300.
Yes, sir.
नेक्स्ट, पर मिनट कितना ऑब्जॉर्ब हो जाता है?
Approximately 20 ml to 30 ml per minute sir.
ओके,
Yes.
क्या क्या फ्लूइड यूज कर सकते हैं?
Depending upon the procedure, for
सिर्फ
monopolar
नाम बोल दो।
glycine 1.5% sterile water for monopolar TRP, and normal saline for bipolar TRP.
अदर फ्लूइड्स, जस्ट नेम ऑफ
Dex,
हिस्टोरिकल इंपॉर्टेंस, नॉट यूज्ड रूटीनली बाय एनीबॉडी।
dextrose 5,
Yes.
mannitol, sorbitol, combination of both.
करेक्ट। देन व्हाट आर द बेनिफिट्स ऑफ एक्टिव एंड वर्किंग
So
एलिमेंट?
active working element, the advantage is it is fast in action, sir. So resection will be fast. Uh, and the disadvantage of active is that the loop or the blade stays outside, so it can damage the bladder mucosa, cause perforation. And also one more disadvantage is that with the depth is not decided. So sometimes with pressure, the depth can go we can go deep
We can
while
cut a deeper,
resecting.
we can
Uh,
resect deeper tissues.
resect, and which is all these opposites are for the passive. So it stays
Yes.
inside. Depth is decided. It is slow in action.
So it is a controlled restriction
Controlled move.
Yeah,
Yes.
controlled
or passive, correct?
For
Yes.
passive. Yes,
but
sir.
but speed is
Speed is less.
Less,
okay.
sir.
तो ये एक्टिव पैसिव का हो गया। वर्किंग एलिमेंट्स के टाइप और उसके नाम।
Sir, active working element is
अभी
bomb
बताया ना मैंने।
wrecker
हाँ,
and passive is nesbit, sir.
Passive is less.
ओके। देन टाइप ऑफ रिसेप्टोस्कोप्स।
So spectroscopes are Monopolar,
अभी नया आता है ना, मूव हो जाता है, कैमरा घुमाने की जरूरत पड़ती है क्या?
हाँ, so it is rotating.
बोलो, बराबर है, बोलो.
Rotating resectoscope, sir. So without moving the outer sheath, it can be used to resect on the different aspects.
रोटेटिंग एंड नॉन रोटेटिंग,
Non-rotating.
कौन सा अच्छा है और क्यों?
Rotating is better, sir.
Right.
So
और
we
जो
don't.
नया पास आउट लड़के को बार बार घूम जाता है ना, फिर वो कैसे करेंगे? वो तो उसको
Sir,
सीधा पकड़ दे, आधा घंटा खत्म हो जाएंगे.
wire entanglement and is.
वो तो डिसएडवांटेजेस है उसके. तो अच्छा है कि बुरा है?
If taken care of these things, sir, it is better. Really. You resect. दोनों, sir.
पंकज सर,
साहब ये तो मेरे लिए भी गूगली होगी, आप ही बताइए.
नहीं, रोटेटिंग अगर इफ यू आर एबल टू प्लेस दैट इन स्टैटिक पोजीशन, रोटेटिंग इज बेटर, बिकॉज आपको पूरा इंस्ट्रूमेंट असेंबली मूव करने का जरूरत नहीं पड़ेगी. करेक्ट है ना? और जैसा नॉन रोटेटिंग को क्या है कि फिर पूरा पूरा वो यूरोलॉजिस्ट ऐसा टेढ़ा होके वो खुद भी उतना ही टेढ़ा हो जाता है. हाँ, तो वो डिफरेंस है. तो पोस्चर्स ऑफ यूरोलॉजी, सर्वाइकल स्पॉन्डिलोसिस, ये सब चीजें है ना, कम है थोड़े से. तो रोटेटिंग इज ऑलवेज बेटर. देन व्हाई देयर इज स्पेस बिटवीन टू शीथ, आउटर शीथ, इनर शीथ? स्पेस रहता है कि नहीं रहता है? पहले ये रहता है तो क्यों रहता है?
Space है, sir, between outer and inner sheath. That is for the return fluid to go in between the outer and the inner sheath, sir, through the
नॉर्मल,
pores.
करेक्ट है. नॉर्मल सलाइन कब यूज करते हैं? फटाफट बोल दो.
Bipolar TRP, sir.
क्या बेनिफिट है बायपोलर और मोनोपोलर का? कौन सा अच्छा है, बायपोलर की मोनोपोलर, और क्यों?
Resection time will be lesser in case of a bipolar, sir.
वाई? सर्जन तो वही,
pla-
सर्जन तो वही है ना.
Sir,
Plasma,
first,
मोनोपोलर तुमने किया, बायपोलर तुमने किया, ऑपरेशन तो तुम ही कर रहे हो, तो क्या फायदा है, क्या फर्क पड़ता
sir, bipolar में, sir, the saline, first, the advantage is it is isotonic. So
है?
that isotonic fluid we are using. Secondly, sir, because of the plasma arc generated in the bipolar, the resection is effective, more effective, and better coagulation, sir. So the field of vision is not
प्लाज्मा से
as
क्लोरीन टेस्ट में होता है,
sir,
नहीं होता है
mono.
टॉर में.
Hello.
जो प्लाज्मा आर्क बनता है ना,
Yes. Yes, sir.
yes, sir. Yes, sir.
कंटिन्यू प्लीज.
बोलो, बोलते रहो. मोनोपोलर है, छोटी वेसल है, कट कर दिया, कोagulate करना पड़ेगा नहीं पड़ेगा?
कोagulate करना पड़ेगा, सर.
छोटा वेसल है, कट कर दिया, ब्लीड हो रहा है, कट खुद ब खुद कोagulate होगा या करना पड़ेगा? तुम करते हो ना डेली, करना पड़ेगा.
करना पड़ेगा, सर. फ्लूइड
हाँ,
एब्जॉर्प्शन.
बायपोलर में क्या करना पड़ेगा? Cutting and coagulation goes hand in hand for small vessels, so the chances of oozing is less.
Less.
Indirectly, the field is very clear.
Field is clear.
So the resection speed is more.
More. So
Yes.
large glands we are able to deal with appropriately with bipolar.
So, पर लेकिन नुकसान कुछ है या अच्छा ही है सब कुछ?
Sir, urethral injury mucosal stricture rates with bipolar is
Picture is more common in bipolar, sir, when compared to
bipolar.
monopolar.
लिटरेचर वाइज तो है वैसा, लेकिन जो करते हैं रेगुलरली उनका उसको उतना एक्सेप्टेबल नहीं है। प्रैक्टिकल एक्सपीरियंस अगर कोई सर्जन रेगुलरली बाइपोलर करता है तो वो एक्सेप्ट नहीं करेगा, लेकिन लिटरेचर सपोर्टिव है उसको, स्टिक्चर रेट कंपैरेटिवली ज्यादा है।
Yes, sir.
देन वो जो बाइपोलर और मोनोपोलर में एग्जैक्टली वो जो अपना लूप रहता है उसमें क्या डिफरेंस है करंट में? व्हाई इट इज कॉल्ड एज बाइपोलर?
So both are active, sir.
Yes, sir.
तो
And
बोथ आर एक्टिव
इसमें
मतलब वो कहाँ रहते हैं बोथ इलेक्ट्रोड्स? प्लस माइनस इलेक्ट्रोड जो है ना, मोनोपोलर का कहाँ का रहेगा और बाइपोलर का कहाँ का रहेगा? मोनोपोलर का बता दो, वो तो बाइपोलर का छोड़ो। मोनोपोलर का कहाँ है? करंट अंदर गया तो वहीं से बाहर आएगा कि और कहीं से बाहर आएगा?
प्लेट्स है सर।
So you use a grounding body plate or patient plate.
Plate.
Yes, sir. That
Patient
plate
plate.
will place in a case of a monopolar, sir.
If your OT boy puts the plate under the shoulder, will you be okay? You're getting ready for TURP, they're giving position. Now the OT boys put the plate under the shoulder of the patient.
ठीक है बुरा है?
No, sir.
No, sir.
Where you will put it?
Sir, it
And
has
why?
to be.
Underneath the thigh, sir.
Why
Sir,
but?
sir, rhythm changes, heart rhythm changes, sir. With
So closest exit from the body, no?
body, yes, sir.
So now you know where the monopolar current is going out from. So what is happening
Yes.
in bipolar? That is what sir was asking. Simple.
So bipolar, sir, the basically what happens is both are active, so that's why it generates that plasma arc.
तो लूप में ही बाहर आ जाता है।
लूप में से yes.
ठीक है, वो बॉडी से बाहर नहीं आएगा।
But sir,
ठीक है, बाकी अब
What is Iglesias system?
Iglesias system is basically the name given for the outer and the inner sheath of the TUR procedure, sir. The Iglesias system it has been defined as a uh, continuous irrigating system, sir. So in this, sir, there are between the outer and the inner sheath there is space with the return fluid can come out. Also, there are pores at the inner end of the sheath through which the irrigation fluid comes between the between the outer and the inner sheath.
So what is the
And
advantage?
so the advantage is that we do not need to empty the bladder every now and then. It comes out on its own, so the bladder is not completely full. Plus, it helps in the better vision. So because the fluid is returning on its own, and we do not need to empty it again every now and then. So it is a continuous irrigation. So the fluid which goes inside
So what
comes
you
out.
have said is correct, but it is still not the most important reason.
Okay.
Why was it devised? Why was Iglesias system devised? It was devised so that the irrigation remains low pressure irrigation. If it's a high pressure irrigation, the fluid intravasation will be very high.
Very high.
Okay. So
Yes.
This continuous irrigation makes it into a low pressure system. So fluid intravasation will reduce.
Yes.
Okay. Yes. Yes, sir.
So the three important things are: one, the intravesical pressure is not increased. Second thing is there is a continuous circulation of fluid, so the vision is much clearer. Okay. And third thing is you don't have to empty the bladder repeatedly.
Yes.
So these are the three important advantages.
So the key point what Pankaj sir has told is low pressure.
Low pressure.
That is very important. So a new Iglesia system is continuous, simultaneous, irrigation, suction, low pressure. 3 point.
Yes, sir.
Continuous irrigation, simultaneously suction, and making
Low
the
pressure.
intrasacral pressure low.
Low. Yes, sir.
What is a Reuter's cannula?
Sir,
It
it
is
is
a
a
SPC cannula, suprapubic cannula, sir.
sir, it is inserted while I mean, it can be inserted while doing TUR procedures in order to keep the bladder empty. So if the outflow is there is a low outflow from our channel, it is blocked. So it is a cannula is it can be kept suprapubically inside the bladder.
Yes. So similar function would be served by a Reuter's cannula. So it will keep the bladder empty. It will maintain low pressure.
Low
It will
pressure.
maintain good irrigation and indirectly help you have a better vision.
Yes,
Yes,
sir.
sir.
You have seen a Reuter's cannula?
No, sir. Then
Okay.
we put
So
IV
there's a
cannula.
metallic tube with multiple holes on the tube, so that the tube doesn't get blocked.
Yes.
Yes, sir.
और कुछ डॉक्टर साहब?
TURP का तो सर मेरे हिसाब से अगर और डिस्क्राइब करना है तो फिर लेजर और ये सब चीज आएंगी. आज ही करना है तो फिर लेजर के लिए भी एक आ सकता है, पूछ सकते हो. मोनोपोलर, बायपोलर और फिर लेजर यूजुअली अभी पूछते हैं क्योंकि बहुत जगह पे रूटीनली हो रहा है.
Yeah, absolutely.
तो
Sir, one question: when they are doing VIU and if there is a bleeding, how they are going to manage it?
बोलो भाई.
We can do a bug B cauterization, sir.
अवेलेबल नहीं है, आगे बोलो.
And that is the last thing you would do. What are the first things you would do?
Perineal tamponade compression.
ठीक है. पेरिनियल टेम्पोरल प्रेशर फ्रॉम आउटसाइड बाय प्लेसिंग द पेरिनियल टेम्पोरल. ओके, नेक्स्ट. बगबी का लास्ट का पॉइंट है, उसके पहले के जितने उतने बोल दो.
We are behaving like a school teacher.
ना ठीक है सर, अब चलता है, क्या करते हैं. बस his answer is
और I will say, sir, मैं बोलता हूँ कि चलो आपने बगवी यूज किया, but the incision on the vessel is, it is not transected, it is parallel, because when you are cutting, we are doing VIU, okay, it is along the axis, so this bugby is not going to act. Now what?
Okay.
Bleeding is not stopped. Now what you will do? You understand what I mean, na?
Yes, sir.
If there is a small hole, okay, bugby will stop with bleeding. But there is a vertical incision on an artery and it is bleeding now. The bugby cannot stop this bleeding now. Now next step, what you will do?
बोलो
You
ना.
said
लार्ज साइज कैथेटर डालेंगे, उससे कम नहीं होगा तो बाहर से प्रेशर लगाएंगे, उससे कम नहीं होगा तो बगबी से करेंगे, उससे कम नहीं होगा तो ब्लॉक करेंगे, एम्बोलाइज कर देंगे, कहाँ से उससे कम नहीं होगा तो ओपन करके लाइगेट कर देंगे. कुछ तो बोलो ना फटाफट. क्या इससे ज्यादा क्या आने वाला है वहां पे, और क्या होने वाला है? तो एग्जामिनर बोलेंगे भाई तू बड़ा एक्सपर्ट आदमी है, सब कुछ कर सकता. बोल के मेरा क्वेश्चन ये है कि बेटर प्रिवेंशन इज बेटर देन द क्योर. सो सर हमारे लाइफ में भी एक आधी बार वो पेशेंट, मेरा पहला भी है 10-15 दिन ब्लीड हो गया, जो मैं ज्वाइन किया और कट कर दिया जोर लगा के, गया पूरा स्पंज का और नोजल फिसला हो गया. पता नहीं था कितना कट करने का, कर दिया. अब क्या कर सकते. तो उसको जो ट्रीटमेंट करना है बॉस ने कर दिया, लेकिन अभी आप ऐसा रूटीनली होता नहीं. समझ रहे हो ना, उतना डेप्थ में काटना ही नहीं है.
वो ऐसे बोलता है, बोला ना पूरा गांव टाइप आदमी.
बीच में कौन
कुछ एडिशनल अनइनवाइटेड टीचर्स है सब.
पॉसिबल है, हो सकता है. तो फर्स्ट है कि उतना डेप्थ में काटना ही नहीं है. इंडिकेशन ऑफ वीआईयू इज गोइंग डाउन डाउन एंड डाउन. समझ रहे हो ना? तो इसलिए वो चीज अगर हो गई तो क्या करना ये पता रहना चाहिए. इतना एग्रीड है, क्योंकि अगर गलती से हो सकता है, नहीं ऐसा नहीं. तो ये 3-4 ऑप्शंस आपको पता रहना चाहिए कि भाई क्या करना चाहिए बोला.
So the way to answer this question will be that I would try to assess whether it's a diffuse ooze or a pinpoint arterial bleeder. If it's a diffuse ooze, then put in a catheter, give external compression. Most of these bleeders would stop on their own. If it's a fresh arterial bleeding, then you will need some form of coagulation. If it's a small bleeder, then Bugbee electrode. If it's a large bleeder, you could use a electrocautery loop and coagulate at that place. And then if it still doesn't stop, then as Dr. Gite Sahib has said, you can use endovascular measures or open procedure. But usually, or rather, I really don't know of any person who had to go that far. Most often with electrocautery, it is possible to coagulate most bleeders.
करेक्ट सर. नहीं सर, बहुत बार प्रेशर लगा दिया तो भी बंद हो जाता
प्रेशर लगा दिया तो बंद हो जाता
है. डेप्थ में तो कोई काटता नहीं.
है. बिल्कुल बिल्कुल बिल्कुल. Are you aware about the rack and pinion resectoscope? What is that?
मैंने देखा नहीं सर. अब
Earlier time it used to be used. So
Yes, means we had a very senior urologist in Mumbai who used to regularly use it. So like here we have the finger operated equipment which you use to move your loop. There
it
is
was
a pinion, means there is a small handle below which you can move front and back so that the loop moves. So it is just a historical novelty you should know, but otherwise no significance today. You would not see it in any say instrument trolley.
ओल्ड इंस्टीट्यूट में अगर रहा तो रख सकते हैं.
रख सकते हैं.
आइडेंटिफिकेशन आना चाहिए और
बिल्कुल.
एटलीस्ट उसके बारे में थोड़ा बहुत बात करने को आना चाहिए. कंप्लीट पता ही नहीं है ऐसा नहीं होना चाहिए.
Yeah, we should keep next time now even the old instruments whatever are available, because I have realized that some of the hospitals now when the exam is there, they have their old instruments and they put it, and these people they get baffled that they have never seen this instrument. So we will just at least for identification we'll keep it.
Surely.
Yeah. Okay, fine. Brijesh, show the last. That then the remaining thing we can do next time. You are showing the sheet, na?
Yes, sir.
Yeah, so we discuss this and then we will stop here. Working element that we will discuss next time in
Sure.
detail.
Sure.
Arey bhai, sheet. Yeah, but no, just stop there. TRP sheet. Okay. Okay. The Brijesh.
हाँ, अरे हैंग हो गया है.
I think, sir, let's call it a day.
सर वो हैंग हो रहा है उसका पी सिस्टम.
Okay, fine. But only just talk about that sheet that he had shown.
सर आउटर शीट इनर शीट के बारे में ऑलरेडी डिस्कस कर चुके हैं हम. ओनली साइजेस बताने का रह गया था ट्यूआरपी शीट का. तो
But
मिनिमम
don't talk about the beak also, the different types of
No.
beak. And
नहीं,
then
वो रह गया सर. बीक के बारे में भी बात करना
हाँ.
रह गया. साइजेस के बारे में भी बात करना
then
रह गया.
from where the fluid goes inside and from where it comes out and why that ergometric relationship.
तो
Anyway,
बहुत
I think we can
बताइए.
discuss. Then all these things we will do next time. This and working element, because this is very important.
Sure.
ओके.
Okay then. Huh?
Good night,
Oh,
sir.
गुड नाइट सर. गुड नाइट.
Good night.
Thank you, sir.
Yeah, good
Thank you, sir.
Thank you, sir.
Good job, boys. Good night. Bye.
No problem. All of you are doing very well. Okay. But more
Thank you,
people
sir.
Thank you,
should
sir.
answer. Then it will be very helpful. Okay.
Yes, sir. Yes, sir.
Okay. Bye.
Yes, sir. Thank you, sir. Good night, sir.